The next question is, says, hello doctor, I am inquiring about your video on safe wisdom tooth surgery near the sinus cavity. Could you please provide information on the anticipated recovery time for this surgical procedure?
So the question is the safe wisdom tooth surgery when a wisdom tooth is lying close to the sinus cavity. So first of all, thank you for watching our video on our social media channels, and we appreciate it very much. And so what you're asking me is your one of your wisdom tooth is possibly like lying close to the sinus cavity. This is your sinus cavity on the right side and the left side here, and one of your wisdom tooth is possibly lying close to the sinus cavity. So whenever you go to your dentist, and they should be able to, in this modern age, we all do what we call it as a CT scan or a CAT scan. In our office, every single one of our patients get the CT scan or the CAT scan when they come for their initial exam or the initial consultation. So once we do that, we should be able to evaluate how proximal is the tooth to the sinus cavity, and depending on that, your dentist or your surgeon should be able to explain to you how safe it is for you to do the procedure. I can tell you, doing this for the last about 30 years, it's relatively safe, or it is very safe, depending on however close it is to the sinus cavity. Only on very rare occasions we shy away from not removing a tooth if it is really high up, near the sinus cavity. On most occasions, we are able to remove them very safely. And to second part of your question, what is your recovery like? Again, depending on what is your age and whether you have any type of medical conditions, whether you do have any type of infection on that tooth that needs to be removed, all of those are going to determine the recovery time from the procedure. I tell this story all the time to the college kids who come see me, and we are in Dallas, Texas. We got multiple colleges here and multiple colleges even in Austin and College Station. So I tell them all the time, kids come to see me on a Friday evening, get the wisdom teeth removed. I don't even see them for a follow-up, and they're driving on Sunday to college back. So it could be as simple as like a day or two for your recovery, all being well. So I hope I answer your question.
Adding to that, habits also play a part in how they heal, correct?
Absolutely, yeah. Smoking, for example, it may make your recovery miserable. So do not smoke, and we give you a bunch of instructions following the procedure. Do not suck with the straw, and do not eat anything hard. And we do give and use the ice pack. If you follow the instructions carefully, and for the most part, the recovery is going to be very smooth.